Hello, everyone. My name is Sierra Kistler, and I'm here with my colleague Connor Young. We are excited to share with you a program we developed called Adolescent Mental Health 101. This presentation will take you through why we created this training, what it includes, how we implemented it, and what we've learned along the way. Our goal today is to inspire upstream community-based strategies for youth mental health rooted in early education and prevention. Before we dive in, we wanted to first take a moment to introduce ourselves. Connor and I both work at Central District Health, which we will refer to throughout this training as CDH. CDH is a local health department in Idaho, and we serve on our health policy and risk reduction team. Having been born and raised in Alaska, I became passionate about mental health access early on. I spent much of my high school years leading out a peer-led suicide prevention program and completed research during my time at Boise State University evaluating youth suicide prevention efforts. When I first started with Central District Health, it was in the suicide prevention coordinator role. I was in this role for about 3 years, and during that time, I had the opportunity to spend a lot of time within the community, giving me insight into the unique challenges Idaho faced, which ultimately led to the creation of Adolescent Mental Health 101. I've since transitioned into a program manager role, and Connor, who will introduce himself next, took over as the suicide prevention coordinator.
Thank you, Sierra. My name is Connor Young, and I am a health policy analyst here at Central District Health, where I oversee our suicide prevention program across our four-county region, including Ada County, which is Idaho's most populous. As suicide prevention coordinator, my focus my work focuses on implementing mental health education and suicide prevention strategies that make a real impact in our communities. I grew up in Northern California, where I first got involved in mental health advocacy. That early experience sparked a lasting passion for stigma reduction and community-led prevention work. I went on to earn my Master of Public Health from Boise State University with an emphasis in prevention and intervention programming. Currently, I am certified to teach QPR, Question, Persuade, Refer, Mental Health First Aid, and Adolescent Mental Health 101, programs I use to equip educators, professionals, and community members with the skills to recognize and respond to mental health distress. While Sierra played a key role in developing our suicide prevention framework, I've led much of the rollout, bringing those plans to life through trainings, outreach, and resource distribution. My focus is on making mental health support more accessible, building strong community partnerships, promoting open, informed conversations around mental well-being.
Thanks, Connor. So, before we dive into the creation of Adolescent Mental Health 101, we really want to provide you with a general understanding of how public health is structured in Idaho, as well as the data that supports the need for such work. So, in Idaho, our public health system is decentralized. We have 7 independent health districts, each responsible for their own programming and response strategies. This gives us flexibility and allows us to tailor solutions to local needs, but it also means programs like ours have to be scalable, collaborative, and built with cross-sector support. Central District Health specifically serves 4 counties: Ada, Elmore, Boise, and Valley. These regions include both urban centers like Boise and deeply rural communities. This mix adds an extra layer of complexity to our work, as we're often developing solutions that need to work in vastly different contexts.
Before discussing our program and its impact, it's important to understand the broader mental health landscape. This section will provide an overview of current mental health and suicide data, both statewide and within the Central District Health region. These trends help illustrate the scope of the issue and the critical need for prevention efforts targeted at supporting youth through the adults in their lives. In 2023, the state of Idaho reported a suicide rate of 23.3 per 100,000 individuals. This rate is markedly higher than the average rate of 14.1, representing a difference of more than 65%. Idaho currently ranks as the fourth highest state in the nation for suicide mortality. These figures reflect a persistent and urgent public health challenge that disproportionately affects our communities. While these numbers are deeply concerning, they also reinforce the importance of investing in early intervention, prevention programming, and mental health education, particularly for adolescents. The data provide a clear foundation for the work we are doing through Adolescent Mental Health 101 initiative. This slide presents key findings from the 2021 Idaho Youth Risk Behavior Survey, which highlights the significant mental health challenges facing adolescents in our state. Approximately 1 in 5 high school students reported seriously considering suicide in the past year. 1 in 10 students disclosed having made a suicide attempt, with 3% of those students requiring medical treatment due to the severity of their injuries. In addition to suicidal behavior, 42% of students reported experiencing persistent feelings of sadness or hopelessness for 2 or more consecutive weeks, an indication of depressive symptoms severe enough to interfere with daily functioning. Compared to the national averages, Idaho adolescents are notably more likely to report both suicide planning and attempts. These figures underscore the urgent need for upstream intervention. Programs like Adolescent Mental Health 101 are designed not for youth themselves, but for parents, caregivers, educators, and other adults who work with adolescents. The goal is to equip these trusted adults with the tools to recognize warning signs, understand adolescent mental health, and respond appropriately to youth in distress before a crisis occurs.
The data that Connor just presented, along with some observances made while doing other suicide prevention work, motivated the need for Adolescent Mental Health 101. As Connor highlighted, Idaho has some of the highest rates of suicide in the nation, and we see those trends reflected even at the local level. From rising emergency room visits for mental health crises to self reported depression and anxiety in our student surveys, it was clear that we couldn't keep waiting for crisis to hit. We needed to act earlier, upstream, and with the people who spend the most time with our youth: parents, guardians, and educators. This was reinforced by the fact that we were struggling to get parents in the door for our suicide specific gatekeeper trainings. And when we did, we felt that it often caused more confusion and panic for them, highlighting the need to move upstream and better equip the parents to have conversations early. Too often, we find that our systems are built to react. When a crisis happens, we respond. But what about before the crisis? We saw a major gap in equipping everyday adults, teachers, parents, coaches with the knowledge and skills to notice concerns early and support positive mental health in their day to day interactions with teens. That's where the concept of moving upstream came into play. Our goal became clear: to build a tool that empowers adults to promote mental wellness, identify potential mental health concerns early, and build resilience in youth before suicide becomes part of the conversation. Our goal was to create short, approachable training that gives adults confidence and tangible tools that they could use. We wanted them to be able to better promote positive mental health in adolescents before suicidality occurs, and really equip them to have the tools to both promote positive mental health, identify potential concerns, and increase knowledge of community resources. Lastly, we really wanted to build protective factors and resiliency, not just at the individual level, but at the community level. In order to create this training, we partnered with a local community-based organization already doing upstream youth mental health work, which helped us to gain buy-in and refine the training content. The training was also reviewed by several mental health experts to ensure that it aligned with best practices and trauma-informed principles. So now that we've given you guys some context as to why this program was needed and some backstory about how we went about developing it, we really want to dive into the content of the training, give you a sneak peek per se. So, the first segment of our training is all about explaining how the adolescent brain develops. We felt that it was so important to equip parents with this knowledge to better understand why teens might behave the way they do. To discuss how the prefrontal cortex, responsible for decision making, is the last part of the brain to develop, and the amygdala, responsible for emotions and feelings, is one of the first. We started with brain development so that we could use it as a talking point for things like why sleep is so important during adolescence and how, because of the brain's neuroplasticity during this time, it's really a prime time to help youth develop their resiliency skills. The next section of the training highlighted what resiliency is, how it can be fostered in youth, and how adults can model resilience. Because we really believe that what adults say is less important than what they do, and that adults' actions really have the power to influence youth. We felt that it was really important to define both community and individual resilience being the skills one develops internally, and community resilience being the environmental factors around one, such as access to services and supportive relationships. We emphasized that individual resilience can be strengthened at any age, but again, because of the brain's neuroplasticity in adolescence, this is really a prime time to foster these skills, and that support from adults is an essential element to developing adolescence resilience. So, after defining resiliency, we really wanted to provide tangible ways of promoting it within youth. We introduced the American Academy of Pediatrics 7 C's model of resiliency, which is really built around two core principles. The first being that youth live up or down to the expectations that are set for them and need adults who love them unconditionally and hold them to high expectations. And the second being that how we model resilience for young people is far more important than what we say about it. So the association summarizes the 7 C's as follows. The first is competence. This is the ability to know how to handle situations effectively. To build competence, individuals develop a set of skills to help them trust their judgments and make responsible choices. Next is confidence. Youth can gain confidence by demonstrating competence in real life situation. Connection, our third C, is all about having close ties to family, friends, and community that provide a sense of security and belonging. Next is character. We know how important it is for individuals to need a fundamental sense of right and wrong to make responsible choices, contribute to society, and experience self worth. Next is contribution. Having a sense of purpose is a powerful motivator. Contributing to one's community reinforces positive reciprocal relationships. Our sixth C is coping. We know that when people learn to cope with stress effectively, they're better prepared to handle adversity and setbacks. And lastly is control. So, developing an understanding of internal control helps individuals act as problem solvers instead of victims of circumstance. When individuals learn that they control the outcomes of their decisions, they're more likely to view themselves both as capable and competent. So, while introducing the 7 C's models, parents and guardians are given the following handout that not only defined these things, but also gave them examples. Things like recognizing and pointing out when your child does something well, model positive self care, and even rewarding responsibility with increased freedom. And the idea behind this was that we really wanted people to leave with a small tidbit of something that they could implement with the youth in their life that very same day. You will have digital access to this handout within the presentation notes, so make sure to check it out if you're interested in learning more. So after we talked about resilience, the next section of the training really highlights strategies to help participants communicate effectively with youth in moments of emotional intensity. We reminded participants that adolescents might be hesitant to approach adults about struggles that they have because they're concerned about how they might react, and asked them to reflect on why this might be. We provided them general tips, such as the importance of being direct, how avoiding the topic can make the topic feel more stigmatized, creating open and vulnerable conversations that allow for better understanding on both sides. Second, we talked about the idea of being available but not necessarily intrusive. And what we mean by that is that sometimes youth are not ready or willing to talk, and pushing the subject is likely not going to be successful. Instead, we remind participants to let their children or the youth in their life know that they are there to talk when they are ready, or even to suggest other adults that they may feel comfortable talking to. We also really highlight the importance of listening to understand and to not respond. It can be frustrating for youth to be offered solutions or compared to others or yourselves. So we talk about the good listening skills, remembering to check in with your body language, facial expressions, those verbal and nonverbal cues, because we know that listening can go a long way in helping youth feel heard and understood. We also talk briefly about the importance of not minimizing feelings. We take it back to brain development and we talk about how adolescents are more prone to experiencing heightened emotions and anxiety compared to adults whose prefrontal cortexes are fully developed. We talk about the importance of, even if you might not understand the issue, we don't want to minimize those feelings. Lastly, we have a frank conversation about the importance of talking openly and acknowledging that it isn't easy to talk about mental health. Modeling vulnerability for adolescents in your life can help reduce shame and stigma and help them practice help seeking behaviors. We then also provided participants with examples of very specific things they could say that modeled positive helping statements. And of course, at the end of this training section, participants were provided the opportunity to role play, which surprisingly from our data was often people's favorite part of the training. So after we talk about specific things you can say during emotional intensity with youth, we really wanted to also differentiate between typical teen behavior and potential mental health challenges. And we wanted to have a framework that adults could use for really assessing concerning behaviors. So this is what we came up with. We came up with the 3Ds model for identifying concerning behaviors. The first D is distressing. So is the behavior causing distress for the youth? We ask participants to brainstorm what distressing behaviors in youth might look like and to share with the larger group. Next is the behavior disruptive. So is it impacting the youth's ability to function at school or at home? And again, we ask participants to brainstorm what types of things might indicate that a behavior is disruptive. And lastly, we really highlight the duration piece. So how long is this behavior or disruptive behavior occurring? So we know that teens can have bad days, and we really want to highlight that it's important to pay attention to behaviors that persist for an extended amount of time, which we highlight as 2 weeks or more. This section also specifically calls out specific warning signs and briefly discusses that while Adolescent Mental Health 101 is not a suicide specific training, if suicide is a concern or the youth talks about wanting to harm themselves or others, that 988 is a great resource and that we do have suicide specific trainings if anyone is interested in learning more. I found this was a really great way to highlight those additional trainings and get parents in the door, but starting upstream. So in the final section of the training, we really segue into how might someone go about mental health, seeking mental health care in Idaho for youth, should they determine if it's needed. So we worked really closely with partners to develop a how-to guide that all training attendees receive. And we spend time really talking about local resources that exist. And again, this guide can be found in the presentation notes if you are interested in learning more. At the end of the training, participants were asked to fill out a post-course survey. So with this training being new and evidence informed, we really wanted to be intentional about ensuring that it was a good training, but that B, we were filling the gap that we intended to. And we knew data was vital for us to know if we were seeing success and if changes were needed to the program.
We launched the training in May of 2023 and implemented it across all 4 counties we serve: Ada, Boise, Elmore, and Valley counties. It's been delivered in schools, libraries, and other community spaces. The flexibility of the format allowed us to reach a wide audience. Our team facilitated the sessions in person and virtually, ensuring accessibility. The format was intentionally designed to be flexible, offering both in-person and virtual options. And each session was facilitated by a trained health educator, ensuring consistency in delivery and a supportive environment for learning and discussion. After several months of implementation, we were able to collect both quantitative and qualitative data to assess the effectiveness of Adolescent Mental Health 101. Our outcomes show that the training met its primary objectives. Participants reported increased knowledge, improved confidence in identifying mental health concerns, and greater awareness of community resources. We also measured behavior change intentions. For example, participants indicating they were more likely to start conversations with teens or share what they learned with others. These are strong indicators of impact at the community level. One of the most encouraging aspects of this project that we successfully reached our intended audience. Our goal was to engage everyday adults, parents, caregivers, teachers, coaches, and that's exactly who attended. We made strategic decisions about where to host trainings and how to promote them, including partnering with schools, youth programs, and community centers. This allowed us to reach people who are deeply embedded in the lives of youth, but who often don't see themselves as mental health supporters and help them step into the role more confidently. Beyond the numbers, the personal stories and feedback we received were incredibly powerful. Participants shared how the training opened their eyes to new ways of communicating with their children or gave them the language to finally talk about mental health without fear or shame. This kind of feedback reinforces that upstream approaches can be deeply meaningful, not just theoretically, but in the real day-to-day lives of families. So some of the qualitative data that we received are some comments included, I gained new tools to have meaningful conversations with my children when they are seeming to be struggling. Another one was, I better understand the importance of asking questions that get to the root issue and that it takes time. Another, please keep this class offering available as they are needed in our community. And lastly, another comment was, I'm so glad we had this group. It was very helpful and it was something I needed to see and hear to help with raising my grandsons better. As we look at what's next, our focus shifts from understanding the problem to strengthening the solutions. We know the need is urgent and growing. The question is now, how do we expand access, deepen the impact, and ensure that more adults are equipped to support adolescent mental health? So let's take a closer look at where we are headed. As we look to the future, our team is focused on strategic expansion, increased accessibility, and stronger community partnership. We plan to extend the training to more school staff and educators, recognizing that those working in classrooms every day are uniquely positioned to observe changes in adolescent behavior and serve as trusted adults. We also we're also working to collaborate with other public health districts in Idaho to scale delivery of the program statewide, ensuring consistent messaging and shared tools across regions. To expand access, we're in the process of translating the training into Spanish, making it more inclusive and available to families who speak languages other than English. Locally, here at CDH, we're building partnerships with child care providers, as well as with our internal WIC and Parents as Teachers programs. These trusted community touchpoints allow us to meet parents and caregivers where they already are and to extend mental health education earlier in the parenting journey. Together, these efforts will strengthen early identification by embedding mental health literacy in everyday environments that support Idaho families. As we conclude, we want to emphasize the direction this work is heading and why it matters. Idaho's youth are facing urgent mental health challenges with rates of depression, suicidal thoughts, and attempts significantly higher than national averages. These aren't just numbers, they represent real lives and families in crisis. We know that early upstream intervention with adults can make a meaningful difference. When trusted adults are informed, confident, and connected to resources, they're better positioned to recognize warning signs and respond before a crisis occurs. Adolescent Mental Health 101 was developed to fill that gap. It is a low barrier, practical tool that addresses a key prevention need by equipping parents, caregivers, and educators with the knowledge and confidence to support youth. Ultimately, this program is about strengthening the community support system around young people, building resistance not just in individuals, but in relationships and environments. And finally, we believe that collaboration is essential. To scale this effort and reach more families across Idaho, we need strong partnerships with schools, health districts, youth serving organizations, and community leaders. Together, we can shift the trajectory of youth mental health, and it starts by supporting the adults who show up every day for them.
Thank you for your time. The PowerPoint slides and training materials are linked for you to access. In addition, Connor and I are both more than happy to connect should you have any questions.